When we're consuming excessive amounts in the absence of physical activity, or we're taking in excessive amounts of alcohol, this is where our triglyceride levels can actually become elevated. That excess glucose is actually going to be converted to triglycerides, and this is where we can get into a situation where now that small dense LDL particle has done damage to the lining of the arterial wall. And now we're going to see where you have these lipoproteins, where you have these triglycerides getting stuck in there and causing the narrowing of the artery potentially. And in the liver, an excessive amount of triglycerides can also accumulate. And now we're going to see things like non-alcoholic fatty liver disease, which has its own set of problems. And there is this tight relationship between dysregulated blood sugar levels and cardiovascular disease. In a lot of cases, if you're dealing with blood sugar levels that are not controlled and you do end up with a diagnosis of diabetes, one of the things to remember is that the disease process from diabetes to cardiovascular disease, it's a cascade. The majority of people who have diabetes are not going to die from diabetes. They're actually going to die from heart disease. Around 80% of people who have diabetes actually end up with cardiovascular disease.